Hi, everyone. My name is Alyssa Rios. I'm a respiratory therapist at the VA San Diego Healthcare System. This is a proposal to design the position for a respiratory therapist to transition to a COPD case manager. The present proposal is intended for the implementation of a new role created within the respiratory therapy department at the VA San Diego Healthcare System. This new opportunity for a respiratory therapist to transition into solely the COPD case manager of the VA San Diego healthcare system. RT COPD case manager will work directly with the pulmonary team, directly with the pulmonary director, Dr. Judd Landsberg, directly with the RN COPD case manager, and within the supervision of the respiratory therapy department and within the chief, Marshall Ramler. This new position will provide follow-up care to every veteran with an admitting diagnosis of chronic obstructive pulmonary disorder. With implementation of this new role in the RT department, patients with COPD will show a decrease in hospital readmittance rates, while showing an increase in all issues that they struggle with to become readmitted. The cost annually that currently is being spent on patients with the admitting diagnosis is outrageous and thus creating a major problem for the VA. Now is the time to set a new plan of action to combat these growing charges, as a population with COPD is not getting any smaller. We must create a new position that helps everyone diagnosed with COPD with every stage of their disease process. Patients with COPD are seen multiple times a year, or even multiple times a season. When these patients with COPD are readmitted within a specific period, the hospital is to blame, thus costing the hospital a lot of money per patient within a calendar year. The purpose of this proposal is to create the position for the RT department to designate a full-time RT COPD case manager and prevent the financial burdens that we are getting penalized with because of readmitting patients. At the VA San Diego healthcare system, COPD patients are one of the most expensive chronic disorders. Patients with COPD are often sent home prematurely and end up being readmitted for the same diagnosis. Many of these patients deal with the identical issues as to why they become frequent flyers at the VA San Diego healthcare system. Self-management, proper medication administration, adherence to prescribed home therapies, recognizing individual signs and symptoms leading up to an exacerbation, and recurrent pneumonias are all common reasons as to why these patients rebound back into the hospital. The VA San Diego healthcare system is a statewide organization and would benefit from the RT to transition to a COPD case manager. Imagine a day when a patient with COPD is pleased and confident in managing their care, without the dread or fear of panic with a COPD exacerbation is brought on. Imagine the day when healthcare professionals are not using the term frequent flyers and seeing the same patients multiple times a season for the same admitting diagnosis, all the while knowing these patients are enjoying their lives at home. Respiratory therapists work bedside, inpatient on every floor of the hospital. They provide breathing treatments, lung expansion therapy, secretion management therapy, ventilatory support to patients in the emergency rooms, ICU, and every ward floor. RTs perform these treatments on patients with pulmonary disorders and provide education during the duration of individual treatments. In San Diego, more than half of the veteran population have COPD as a comorbidity. Respiratory therapists are highly educated health professionals who work one-on-one with patients with COPD. Patients with COPD are often seen multiple times a year. According to a research study, the pulmonary disease COPD is responsible for more than 700,000 patient admissions every year. With a growing bill of $32 billion direct in costs in the United States, this large amount spent on one patient population is outrageous and can be avoided by spending more time with these patients one-on-one. In 2010, the Centers of Medicare and Medicaid Services created a hospital readmission reduction program, which included the Patient Protection and Affordable Care Act, to improve the quality of patient health care. As part of this program, the hospitals are charged and penalized for poor outcomes for high-risk conditions, with COPD joining the list of high-risk conditions in 2015. Although smoking rates have declined with the help of the changing laws in San Diego, people are quitting cigarettes and picking up vapes, thus creating the major problem that COPD will continue to rise exponentially through the years. As part of another research studied in respiratory therapists providing health coaching to patients with COPD to manage their lives of self-efficiency and self-management. Self-efficiency deals with the breathlessness aspect of the disease itself. Coping focuses on the emotions associated with the worsening symptoms. And in this research study, RTs met with patients prior to discharging from the hospital, provided telehealth teaching once a week for a total of 3 months to all patients with a discharging diagnosis of COPD. Each telehealth session provided patients with an encounter using motivational interviewing techniques and discussing key concepts such as self-management, goal setting, action planning. During each encounter, the RT focused on setting the tone, which was that the patient is cared for, and is important, which allowed patients to open and be willing to talk about their COPD. Self-management being the primary goal, and inhaled therapy being the gold standard, adherence for patients with COPD is on the decline. Non-adherence rates being particularly high, with 50 to 80% with patients with COPD. Patients with COPD may not adhere to prescribed medication or treatment for a multiple of reasons. Increased adherence for patients with COPD at any stage of their disease process could lead to decrease in mortality as well as increase in hospitalizations and dramatically change the patient's quality of life. An RT COPD case manager would contact the patient as a reminder and follow up to the physician's treatment plan for all patients discharged. The RT COPD case manager would remind the patients of the progress they made while inpatient and encourage patients to continue their healthy streak while at home, providing their own health care. According to another research study, poor adherence in COPD patients could be associated with dosing regimen, drug side effects, age, cost, comorbidities, patients' personal perception, and many other issues. With self-management being the primary goal for preventing hospital rehospitalizations, another study implemented a program for COPD post-discharge. This research study discovered that there was 2 types of patients, a disengaged patient and a distressed patient. These were the 2 types of patients that were more often seen in these rehospitalizations. And these are the patients that we need to focus on, as sometimes there could be other issues as to why they do not want to adhere to the medication or to the therapies prescribed at home. Talking to these patients one-on-one would provide a sense of rapport to these patients and provide a follow-up, that's something that they could actually look forward to. A distressed patient is a highly emotional patient, and if there were more issues that lied beneath the COPD, we could refer these patients to other departments and they could help these patients with their distress. When creating the role of a COPD case manager for the VA San Diego healthcare system, a respiratory therapist would be the go-to person to fill this position. An inpatient respiratory therapist who is already employed at the VA San Diego healthcare system would save billions of dollars for the hospital on these readmission rates. An inpatient respiratory therapist currently makes $77,059. An RT, which would transition to this role, would have to become a supervisor of this new position, thus creating their salary $89,383 with an annual difference of $12,324 for one RT at the VA San Diego healthcare system. Also, this RT would have to become a pulmonary disease educator by taking the course on the American Association of Respiratory Care. The course costs $290. So with less than $13,000 a year, we could help these patients with COPD live more comfortably, increase their quality of life, prevent readmission rates by being available through telehealth, and providing the therapies they need once a week. In conclusion, patients with COPD need a designated RT COPD case manager. We are the people that are at their bedside when we give their breathing treatments, during their oxygen therapy, if they end up on the ventilator, during their pneumonia, while they come in for pneumonia and they're unable to breathe and they have so much stuff in their lungs. We're the person listening to their lungs so we can listen to their words. Thank you. I hope that we can actually make this new position in the RT department at the VA San Diego healthcare system. I look forward to hearing what you guys think. Thank you so much. Have a great day.